Thank you very much, Sally. Georges?
Well, thank you, everyone. I think Sally made a very eloquent case for our central challenge being really how to achieve better health and well-being. And just remind you that, like politics, all health is local and personal. There's no question about that. While I personally believe that healthcare is a fundamental human right, and while we've never said that as a nation, I'm a former emergency physician. I can tell you that that's the way we behave. We don't step over people in the street. The challenge we have is that we have allowed ourselves to provide universal coverage in the most inefficient way possible, and healthcare as well. So I think we need to move very, very much upstream. And what this report does is talk a lot about how best to do that as far upstream as we can. And one of those very important tools is by activating communities in a way to improve both individual health and population health. Now, I remember the days, not so long ago, when we used to struggle to talk about the social determinants of health. But it is widely accepted now that your zip code is a marker of your health status. That really isn't debated, whether it's on the left or the right, whether you're in urban settings or rural settings. That literally, we're not having that debate in most settings. We are still having that debate about whether or not, it's the federalism debate, whether or not and how much the federal government ought to be doing this versus state and local communities. And that's a fair debate to have, because it's one about resource allocation and rules and regulations, et cetera. But if you actually look at the evidence, and there's a mounting growth of evidence, in fact, I would argue now the preponderance of evidence is that doing things across sectors in a collaborative way gives you enormous benefits, and not just for health, but also for economic development as well. Now, we had an election, and on November 7th, the United States was not getting the best value for our healthcare dollar, and I would argue that on November 9th, we were still not getting the best value for our healthcare dollar. The point is, while we've made enormous progress in health in many ways, the central challenge still remains on how to get the best value for our healthcare dollar. And I would argue that rebalancing the equation in many ways around healthcare expenditures, social service expenditures, moving from our healthcare dollars and expenditures on the healthcare side down more, very much upstream to prevention, and figuring out ways we can leverage that across sectors is extremely important. Imagine the future where we have people who are outside the health sector viewing themselves as, in effect, the chief health strategist of their community. The health officer certainly ought to believe that, but the local business in town very much can be the chief health strategist of that community in terms of trying to figure out how you leverage the activities of those communities, doing that through strategic partnerships, looking at how best to spend our dollars, again, in a collective. Getting the healthcare sector, the healthcare delivery sector involved. They don't necessarily have to assume the responsibility for public health as we commonly seen it, but having the government relations person show up at the legislative hearing for the budget, for education, for social services, et cetera, allows them to be part of that process and to move that agenda along. There's no question that we have to build a good system for that. It has to be adequately funded and sustained. But if we don't do that, we won't get there. And I do think we talked a great deal about measuring what counts and not measuring everything. That's going to be very important as part of putting this all together. So I think in summary, as we think about how best to move upstream, again, just to reiterate the importance of moving as far upstream as we can, doing it in a collaborative way, identifying health as a core value and our ultimate goal across sectors is probably the best way to start that process. And the Vital Records, both the collaborative paper you see here, which is consolidation of all of our ideas, as well as the individual paper set in our health and well-being, makes a very, very coherent argument that I hope as we move forward, as we begin to think about what our healthcare system needs to be in the future, that we follow that roadmap.